opinions expressed on Dr. Radio are intended to address the specific questions asked or situations described on the program and are not designed to constitute advice or recommendations as to any disease, ailment, or physical condition. You should not act or rely upon any information contained in this broadcast without seeking the advice of your personal physician. If you have any questions about the information or opinions expressed during this broadcast, please contact your doctor. Thanks for listening to Dr. Radio.
No referrals, no waiting room, no copay. Direct from the NYU Langone Medical Center. This is Dr. Radio.
This is Sirius XM Dr. Radio.
From the heart of the NYU Langone Medical Center, this is Plastic Surgery.
Welcome to the Plastic Surgery Show. I'm Nolan Karp, and we are live from our studio in the lobby of the NYU Langone Medical Center. We have a great show tonight. Our first hour is going to be male facial plastic surgery, and our guest is Dr. Richard Greco. Greco, you there?
Hey, Nolan. Yes, I'm here. How are you?
What's going on, man? How are you?
I'm great. Thanks for having us on.
Dr. Greco. Us? Who else? You're on there with somebody? I'm just joking. Dr. Greco is a board-certified plastic surgeon and senior partner of the Georgia Institute for Plastic Surgery. He's president of the Royal and Ancient Society of American Plastic Surgeons. What's that?
So it's a group started by Scott Spears about 15 years ago of some of the leading plastic surgeons in the country who interact with industry. And we have, 4 or 5 day meeting once or twice a year where we help innovation with industry and have meetings and some good afternoon breakout sessions.
All right, sounds like fun. Anyway, our topic is male facial plastic surgery. So, how popular is plastic surgery in men?
So, we've known for the last 30 years there's been a transition for women. It used to be women would have surgery and then hide out, and today women have surgery, they go out with their bandages on and are very vocal about the fact that they've had plastic surgery. Men are where women were 30 years ago. They're having plastic surgery in increasing numbers, but they're very quiet about it. They're still not very open about it, but it's really because of second and third relationships and working longer and wanting to look competitive. And part of it is, I like to say, men used to age gracefully. The problem is today we're getting to the point where we're growing and getting to be so old that we actually get old looking too. And so, there's a new emphasis on looking young and looking vital and competing with other people, both in the world of relationships as well as work. And so I would say that probably 20% of my facial aesthetic population today is men.
So that's a lot. What would you say it was, let's say, 10 years ago or even 5 years ago?
So I would say it was probably sort of between 5 and 10% forever, which included, rhinoplasties and otoplasties. But really what we're seeing is more and more blepharoplasties, more fillers, Botox, and now it's different in what men choose. They like smaller procedures, so more direct excisions of neck to get rid of that loose skin in their neck without actually having to be put to sleep. They want small procedures. I mean, we still have people who will do the entire facial rejuvenation, but men they stick their toe in the water and do smaller procedures. And so, the first things that I usually see men for is Botox, especially for lateral periorbital iridities. And then
so that's crow's feet around the eyes.
Crow's feet around the eyes. First thing that people come in for. Second thing is excess skin of their upper eyelids. A lot of them come in with functional excess skin of their upper eyelids. Many times I'll have a husband of a young lady that I've done facial rejuvenation on, that they'll come in and say, geez, can you do that for my eyelids? Because upper and lower eyelids in men really are probably one of the first things that really we notice in aging in men. And so their upper and lower lids are very common in men. And then I would say that the next thing that I really see are people complain about the loose skin of their neck. And then it's really a discussion over how good do they want to look versus how much surgery they want to have, whether we discuss, direct excision, sort of a T excision of their neck, which can be done under local anesthesia or some PO sedation. And really the scars turn out very nicely, and they truly get rid of that entire loose skin beneath their neck. Many times we plicate the muscle or the muscle bands, the platysma there. Sometimes we take out a little fat in that area while we're there. So it's just like what we do in a standard facelift, but directly, because you can do it under local anesthesia, and really the downtime is very small.
Our phone number is 877-NYU-DOCS. That's 1-877-698-3627. Our topic is facial male plastic surgery. Feel free to call us with any questions. So men generally start out small. So do you think you'll have a guy and he'll get Botox? Do men do fillers?
Yes. So, interestingly, there are some men that come in that look great. They just have really deep nasolabial folds. Some of them we can improve with fillers, and some I've done, quote-unquote, the reverse facelift, which is a direct excision of their nasolabial folds. And really, that scar hides very well in men. It's right in the nasolabial folds. It gets rid of their deep, nasolabial fold, and they just have really a deep, almost like it folds over, and it looks great. So, one of the advantages, I think men actually heal with direct excisions on their face better than women, for sure.
Now, why do you think that is?
I don't know if it's the thicker skin, the beard, the hair follicles. I'm not really sure, but, not to say I rarely would do that in a woman, although we do it when we do skin cancer on the nose. We do those nasolabial fold flaps and put a scar on their nasolabial fold and do very well with it. But I just think it's less obvious on a man than it is on a woman. And so I'm willing to offer them that more than I do to women, for sure.
So, but what fillers do you do mostly in men, and where do you do it? Do you do it in the eyelids? Do you do it in the folds? Let's say they choose not to have excision in the nasolabial folds. Do you do fillers there, or do you find the fillers? It seems to me that you don't get as much out of them in men as you do in women.
So the things that I have found to be valuable is in sort of the 40 to 55-year-old men using actually Voluma or lift in their cheeks if they're flat to help lift up some of the jowl. I do think it works as well in men as it does in women. Don't build up the cheekbone as much, more diffuse and coming down further. Because as we get older, the problem is we have more skin than we have volume. We lose some volume, just like most parts of our body. It's too much skin for the amount of volume. And if someone doesn't want a surgery, the next step is to add volume. Well, you take one of the volumizers, Voluma, lift kind of stuff, use it either in the cheek area or in the sub-cheek area to sort of give the person, if they're flat there, a lot of these people look like they're not gaunt, but they have, lost some volume. And you fill that up, and it does help lift up a little bit of the jowls. So that's an easy enhancement without having surgery. No question, nasolabial folds, yes. Not lips. Sometimes wrinkles around the parietal area, on the chin. Some people will have like deep creases or something that we can, the oral commissure groove, those areas, they do well with that. I've not used a lot of fillers in the eyes of men. Most times men's eyes don't bother enough for little things, and if they have really big bags, I don't think fillers is going to solve their problem. And those people, I recommend they consider, a blepharoplasty kind of procedure, whether transcons or whether a standard, but as you would normally evaluate based on the amount of skin laxity, etc.
Now, in terms of Botox, you said you do it for the crow's feet around the eyelids. What else do you do? You do the forehead and
do you do... So the berry is, I have a fair number of lawyer clients who really like Botox in their glabellar area, some in their forehead, some in the lateral perorbita, because they don't show surprise. Like if they're in a court case and something happens that they weren't expecting, nobody can tell. They don't all of a sudden have a facial animation that says, "Oh my gosh, he just got caught or fooled, or you didn't like what he just said. So people who are doing a lot of negotiating, they sort of like to be softened in those areas so their expression isn't quite as much. It does a great job of helping with some of the wrinkles of the forehead. It does a great job of getting rid of the deep glabello, the 11s or the glabello furrows. I'm not a person who injects fillers in the glabellar area at all, but I will inject Botox to try to reduce, the creation and softening of the 11s. And then lateral periorbita. They're really the only places I inject Botox facially on a male.
Our phone number, 1-877-NYU-DOCS. That's 877-698-3627. Do you find men are coming earlier, Rich? I mean, are they coming in, we'll see women in their 20s, 30s for Botox,
I would think,
fillers.
I don't see them at that age. I see, the earliest I usually see them is in their 40s. And that's for crow's feet. Men have thicker skin. I think they don't show the wrinkles quite as young as women do. Men probably don't lay out in the sun quite as much as women do. So I think both those things make a big difference in that. So generally men will start coming with some wrinkles, and they're almost starting to have loose skin of their eyes at the same time. So they're very similar kind of, I'd say they come in for Botox, and in the next 5 to 10 years, their skin of their eyelids become their issue.
Now, how do the eyelids in a man compare to eyelids in a woman? And then, how are the goals different in men versus women?
Excellent question. So, many men have brow ptosis, and you really have to look at the person and determine, men have heavier set brows, and if you take the skin off their upper eyelids, it may just let their brow drop further. So, the first thing is to make sure that what they don't need is an endoscopic brow lift versus upper lids. Once you make that decision, if it's upper lids, the important thing is you don't want to feminize a male. So it's a little bit, when we talk about facelifts, when we talk about lifts, brow lifts, all those things, it's important that men cannot look like they've had plastic surgery. Women can. And it's okay, not that they want to. I believe in a very natural look, but a woman can live with having the appearance of having had some plastic surgery much more than a man. Man wants to be very natural. So whether we talk about their brow or whether we talk about their eyes or their facelift, most important thing is they have to have hidden scars. They have to look like when they're done, you rather underdo them than overdo them, because you just can't have that, as a facelift example, a windblown look in a woman is terrible. It's devastating to a man. Having high arched eyebrows in a man, can't happen. And it's important when you do facelifts, where do you put your scars and how do you hide those scars, and just doing it in a way that it looks very natural, and that, certainly for the first 2-3 weeks of a facelift, anybody, you're going to be able to tell they're swollen, but you have to get to a point where in 3 months that no one can really tell they've had surgery. They just look better.
Now, we have a phone call. We have Aaron from California. Aaron, you're on the Plastic Surgery Show.
Hello.
How are you?
Good. I was wondering, I heard the doctor mention release of the platysmal bands. So those horizontal lines on the neck? Is there a similar procedure for women?
Well, they're not the horizontal lines.
So that's a good question. The question is, do you have two kinds of lines in the neck? You have the bands that go from the chin all the way down to, your clavicle area. So if you bite down, you see these two straight lines. That's the edge of the platysma. And there are things that can be improved. It probably is only in 5 or 10% of the patients that I find, and Nolan, I don't know what your experience is, but 5 or 10%. I know Dr. Baker never opens the neck, and Dr. Aspen does in a certain number. My rule is if they bite down, I can see the bands on both sides, and they're prominent, they're going to come back sooner than I want. So in those patients, we do a submental incision, and we sew the medial borders of a platysma together so that you get a nice sheet. The horizontal lines generally are from sun damage, and sometimes when you do a neck, you release those and they'll look better. But there is no great operation if it's sun damage to get rid of the horizontal lines you're talking about.
Okay. Okay, great. Thank you.
All right, Aaron. Thanks so much for calling. Our phone number, 1-877-NYU-DOCS, 877-698-3627. Or you can email us at docs@SiriusXM.com if you can't get to the phone. So, we were talking about blepharoplasty, brow lifts. Now, so you do mostly endoscopic brow lifts in men?
Yeah, so men are sort of interesting. Yes, I almost do. I used to do a lot of standard brows. I haven't done a standard brow probably in 10 or 12 years now. It doesn't mean I don't do anterior brow lifts, which, if someone has a high forehead or they're somewhat, we want to bring their hairline down, doing an anterior hairline incision really is a very elegant way. The scar is hidden very well, and you can shorten their forehead. So, yeah, I'll do that. But, yes, endoscopic brow lifts I find very helpful. And I know there's a trend. There's some people going back to doing standard. What are you using for your brows today? Or do you do brows? No,
they don't do many brows. Since with the advent of Botox, I really have, my brow lift surgery's become almost, I wouldn't say non-existent, but very low. And I really don't do many brow lifts, really. But, it's definitely, there's some indications. When I was doing endoscopic mostly, but pretty much haven't done that many of them in the last, 5-10 years.
So the area that I do the most brow lifts, so number one, people who have brow ptosis, people who have that lateral hooding, you do their upper eyelids and you can see they're going to have that lateral hooding and you don't really want that. I have a hard time getting Botox to get the brow to raise enough. Most times when you inject the forehead, if they have wrinkles, it goes down, not up. I mean, you can try to keep it stable, but rarely can you get rid of the wrinkles and go up at the same time, at least in my hands. Second thing is I do like, doing the endoscopic brow with a little bit of an anterior face pull or associated with a little bit of an anterior facelift to not have to do the neck and not have to do their whole thing, but to rejuvenate their eyes and their cheek and their brow all simultaneously. So there are areas that I like brow lifts. The other thing that I never do brow lifts above their eyebrows. I mean, I've seen people do that in men. I don't find that to be a good operation. I do.
So you mean direct skin excision above the eyebrows?
Right. I'm sure you've seen those in the
movies. Oh, they look horrible.
They look horrible. And I also don't make incisions in the middle of their forehead. People have done that. I don't mind doing incisions right in front of the hairline. It's just like an anterior hairline incision if they have high peaks so that I don't go all the way, back. But, yeah, so I have found it helps open up their eyes. And specifically, there are a lot of men with really deep furrows of their forehead and deep glabellar furrows and, that lateral sag. So for those people, I find it to be valuable. But you're right. And the other thing is some people get tired of getting Botox. They say, listen, I've been...
It's costly. Botox. I mean, it adds up. It just adds up and adds up and adds up, especially if you come in 3-4 times a year. And guys, I think, eat up the Botox faster than women.
I think you're right because they have maybe stronger muscles, bigger muscles in that area. Who knows? But you're right. And then when they say, listen, what I'm paying for this, I could just have the surgery and then minimally have to come back at all for Botox. And the answer is that's a true statement. So I think as part of some of the trends, I don't know, I think that Botox and fillers have been a great way to delay cosmetic surgery. But there are so many people who have been on it for 5 and 10 years, and they're significantly older and we're living longer, and all of a sudden they're coming in and saying, you know what, I've been doing this and it doesn't hold me anymore. It's not as good as I want it to be. It's not doing what it used to do. And then they have rejuvenation surgery. So definitely it's been it's delayed, but it's gotten more people interested in the idea.
And what do you do with men who have, receding hairlines? Are you still able to, like an endoscopic brow lift, or what are you doing?
So those people, yep. So the answer is those people, I don't really mind putting a small transverse scar, high on their forehead, because they heal very well. Men heal well. I would be more reluctant to do it in a woman, but men seem to heal well, and I try to put it along the hairline of the peak. So I try not to stick it out in the middle. I try to move it to one of the edges of the hairline so that it's at the junction of the hair and their peak.
So you've done a brow lift. Did you do the brow lifts combined with a blepharoplasty, men, or will you do a brow lift and then...
So it all depends on how bad their skin is. So if it's just minimal, what I do is I test people and put the brow where I want and look and see, does it make a nice enough enhancement for their eyes? If it does, that's all we're going to do. If, they're one of those people that almost have visual defects associated with loose skin of their eyes and then also have a deep-set brow, so they're going to have some, we're going to sort of put their brow where we want them and then mark their excess skin of their eyelids. I'll do the upper lids first and then do the brow. So that they're not over-resected, and then also position the brow based on making sure that the eyes can close and look natural.
Now, how are the lower eyelids different in men than in women? Do you do different things, or how is it different?
Well, I would say that in men, a lot of them, when they come in, have very lax lower eyelids. And so, you have to... you're probably very much from the Glenn Jelks world of either someone's going to get a transconj or they're going to have a lower lid with a canthopexy. And with men, you really want to make sure if they have really, really lax lower lids, they may even need, a partial wedge excision so that at the end they don't have, an ectropion or a pull down, because a lot of men have very heavy facial features and it just seems... You have to be more careful not to get an ectropion, I think, in men than you do in women. I think their features are heavier, and again, they're not tolerant of even small amounts of postoperative difficulties. So, you have to overplan for minimal complications.
And I find that men have festoons.
Yep.
Or really have more problems with lax muscle and fat in the lower eyelids than women. Have you found that?
Yeah, absolutely right. And I think their whole unit is, their lower lid's lax, their skin's lax, they have big bags. That's why I said I rarely put fillers in their lower eyelids because, if they come to see me with lower lids, the problem is they got problems and filler's not going to solve it. It's going to just look, and of course there's always candidates that will, but most of them, I don't find them in that stage.
Our phone number, 1-877-NYU-DOCS. That's 877-698-3627. We're going to move on to Lorenzo from Ontario, Canada. Lorenzo, you're on the Plastic Surgery Show.
How are you?
Good. How are you, Lorenzo? Cold down here.
Well, it is freezing down here. We're hitting a cold spell, so it's quite cold.
Yeah, it's cold here, too.
So the question about fillers. So I consulted a plastic surgeon last year, and I work out quite heavily, so I'm losing some facial fat, and I'm pretty lean. I'm 6'2", 170 pounds. So I started to notice that, underneath my eyes, it's sort of a darkening. And I asked him about using fillers, and he said, well, I really wouldn't recommend that because it would feminize your look. And I didn't quite ask him as to why he thought that, and I just wanted your opinion on fillers under the eyes for men.
So what do you think, Rich?
So, of course, you have to look at each person individually and look at your bone structure and your cheek structure and what exactly you see as a problem. Typically around the lower lids, things people come in for is one of three things, and you can tell me if you see any of these. One's a tear trough, so that's sort of like in the medial aspect of your lower lid, you have sort of a line that's on an angle. And then you have sort of a bulge that sticks out. The second is typically there's a bulge there, and then there's like a little crevice right along your bone, the supraorbital floor. Infraorbital floor, right? Yeah, thank you.
So the bottom of your eyelid floor.
Bottom of your eyelid. So tell us, what do you see? You say you see a little discoloration. Yeah. Do you find that there's actually like a indent someplace for you?
Correct, and more on the lateral side of the eye.
More on the lateral side.
Kind of like more on the lateral side towards the temple. So there's some, loss of facial fat in that area. So it kind of looks like a slight indentation.
So, it comes down to each individual sees a deformity, and then the plastic surgeon looks at it and says, if I try to do this, what's it going to look like? And there are certain things that do, quote-unquote, feminize people, but if that's the way you used to look, meaning if you look at your picture 5 or 10 years ago and it wasn't indented there and you liked it, then it's not going to be feminizing. We're just going back to where you came from. And so that would be something reasonable to do. So I really, it's a very individual thing. It's looking at you, looking at where you came from, and then saying, am I trying to recreate what you had? If that's true, and you look good then, there's no reason to think you couldn't do it. What are your thoughts, Nolan?
No, I agree. I mean, I think you have to see every patient. I mean, I think that certain men with what I would consider relatively minor deformities, the lower eyelids will be fine with fillers. It all depends the degree.
Is a cannula the best technique? Is it cannulas, I guess, they use to put the filler under the eye? Or a butterfly?
I mean, I tend to use
ways to do it.
I tend to use a cannula, a very small cannula to do it. I don't know. What do you do, Rich?
So I use different things, but for the lower eyelids, cannulas are very nice because, you're less around the eyes. You're very worried about injecting filler that might go to the retinal artery and cause blindness. That's the biggest bugaboo. Like, I don't inject glabellas because of it, and when I inject lower eyelids, I try to stay on the periosteum or far enough away that I'm not in the plexus that I think is going to go to the eye. So in using a blunt cannula, it gives you a lower chance of cannulating a vessel that will go someplace and cause problems. So cannulas are, I think, valuable in that area.
Okay, great. Okay, wonderful. Okay.
All right, Rich.
Good luck.
Good luck, Lorenzo. We have an email from Kevin. He goes, Kevin, this is me reading what Kevin's saying. I'm listening to the show and interested in plastic surgery, but I don't always like how fillers look in women's faces. My biggest complaint are lines around my mouth. Options. So this is a male with lines around the mouth. So.
Okay, good question. So, it depends a little bit on what is the cause of the lines. Are you a smoker? Do you have, it depends upon the age. So we're going to look and see what the elasticity is. So lines, you can use very small units of...
He is a smoker, it says.
He is a smoker, okay.
Yeah.
So obviously, stopping smoking helps. You can use, because it's no matter what we do, we're going to recreate them over time if you continue to smoke. You could take very small aliquots of 1 to 2 units of Botox and put them in a couple places to sort of weaken, the orbicularis function, the muscle around the lips, to try to reduce the creation of wrinkles and the expression of them. You can use different kinds of fillers or fat grafting to fill in those areas. One can use laser or dermabrasion to smooth out those areas. Bigger procedures, longer downtime. Men usually don't like that. So I would say that either I would try small aliquots of Botox first, and if that didn't solve it, then I would use fillers.
All right. We're going to take a little break, and we are going to be right back.
To have to learn just like me, and that's the hardest way. Ooh la la, ooh la la, la la, yeah.
Never miss a beat of Dr. Radio with the Sirius XM app.
Dr. Radio.
Hear it everywhere with an online subscription. Go to SiriusXM.com to learn more.
The Sirius XM News channels. Breaking news from the biggest names in the business. Fox News. I'm Shepard Smith.
Hey, it's Sean Hannity. Welcome to Tucker Carlson tonight.
MSNBC.
Welcome to Morning Joe.
I'm Chris Matthews.
I'm Rachel Maddow.
CNN.
This is Chuck Todd. I'm Anderson Cooper.
I'm Wolf Blitzer. You're in the Situation Room.
News from around the world.
World news from the BBC.
And hear the latest headlines updated every 15 minutes. Fox News headlines 24/7. Sirius XM News, channels 114 to 120.
Wednesday on Doctor Radio at 6 a.m. East. Life's Simple 7. Dr. Fred Fite reviews the American Heart Association's suggested list of healthy behaviors that can help prevent diabetes and lower your risk for developing heart disease. Find out how you can easily incorporate them into your daily routines. At 8 a.m. East, Dr. Munich Turian discusses cervical cancer prevention and treatment. Learn why getting a Pap test and being screened for HPV should be at the top of every woman's resolution list. That's some of what's happening Wednesday on Sirius XM Doctor Radio.
Hey, this is Jeff Foxworthy.
Larry the Cable Guy here. Happy to bring you
Jeff and Larry's Comedy Roundup. And I was even there when you had first started doing the Larry the Cable Guy thing.
I went on stage one day and I said, hey, this guy ever come over to your house? Hey, did you order cable for somebody that ordered something? And I did that for about 10 minutes. Rob Schneider said, that Cable Guy thing is hilarious. And David Spade goes, that's a Saturday Night Live character. Jeff and Larry's Comedy Roundup.
Listen anytime on the Sirius XM app.
The biggest name in contemporary blues is on Sirius XM's Bluesville.
Hi, I'm Joe Bonamassa.
With his own weekly show.
Join me for an hour of music from my personal collection on different shades of blues.
Vintage blues. And new blues, too. Different Shades of Blue with Joe Bonamassa. Catch a new episode Mondays at 6 p.m. Eastern, 3 p.m. Pacific.
On B.B. King's Bluesville, Sirius XM, Channel 74.
Here's what's happening on Sirius XM Sports.
How can the NFL avoid another officiating controversy like Sunday in New Orleans? Discussion now on Sirius XM NFL Radio.
Given the choice between making sure you got a satisfying result and watching football for what could be 5 to 8 minutes long, because let's be fair, it's not going to be any longer than that if we limit the challenges, what do you think people would select?
Complete coverage of Super Bowl 53 on Sirius XM NFL Radio Channel 88 and the Sirius XM app.
A dose of Doctor Radio.
So we do worry about sometimes people mistaking something for an infection, using an over-the-counter product, and then getting an allergic contact dermatitis or irritant dermatitis that they confuse for a worsening of their infection.
I know a lot of people take biotin when their hair is falling out, but unless you have a deficiency, it's not necessarily going to help.
Doctor Radio, because it matters where and when you get your health information. Sirius XM 110.
Unprecedented in access to top physicians and the location within the NYU Langone Medical Center. This is Doctor Radio.
Welcome back to the Plastic Surgery Show. I'm Nolan Carpenter. We are live from our studio in the lobby of the NYU Langone Medical Center. Our topic today is male facial aesthetic, plastic surgery. And our guest is Dr. Richard Greco, who is a board-certified plastic surgeon and senior partner in the Georgia Institute for Plastic Surgery. Rich, you there?
I'm here, Nolan.
All right, good. We have a couple of callers, and then we're going to talk a little bit more about surgery, like facelifts and things like that. So let's take Bob from Pennsylvania. Bob, you're on the Plastic Surgery Show.
How you guys doing?
We're good.
So, all right, my question is, I have my right in the middle of my forehead towards the right, there is a dent from forceps when I was born. So I'm getting older, so it's, I guess, getting more visible as my hairline goes up. What would you guys recommend? I know I've gotten some opinions in the past. One person wanted to operate, just cut it and fix the underlying tissues and hoping that will look better. But then obviously I got scar to worry about. And then someone else proposed injecting fillers, and we did that once with radii, I think. But that went away in a few months. Yeah, radii, something like that, yeah. Then it went away. So what do you guys think I should do?
No, we can't see it, so that obviously makes it hard. Is it in the bone, or is it a soft tissue defect, Bob?
I don't think it's in the bone. I think it's, according to when they looked at it, it was soft tissue, yeah.
I don't know, Rich, have you ever seen something like this before?
So it's interesting, Bob. Good question. So when they use the radius, did it look better for a while?
It did, yeah, for quite a while. I mean, the first month and a half, 2 months, it did.
Okay, so that's a good answer. So what it tells us is that if you have soft tissue filling of some sort, that you will probably, and if you were happy with it, that we can find a way to do that. And so what are the different ways one can do that? Well, there are temporary kinds of fillers that you can use, such as the hyaluronic acids, the Juvederms, the Restylans kind of stuff. There are longer-term ones, Lift and Voluma, that'll last a few years, and then they have those types that actually have little glass beads that are more expensive, but it's a collagen with glass beads that you can inject in the area, and it'll last forever, really, I mean, for many years. In addition, there's also fat grafting. So if for a period of time you were happy with the way the radius looked, then a doctor could take some fat from another part of your body and then inject it in little aliquots throughout that area so blood supply can grow into it. You overdo it a little bit because we know we're going to lose some of it. And you may even need more than one session to make you happy. But those fat cells that actually survive will stay there forever. And you may have to build on them. But if it's purely a soft tissue defect, that would be the approach that I probably would recommend once you've already tried with fillers and we're happy with it.
Perfect. So I'll definitely give that a shot. Thank you for your help.
You're welcome, Bob. Good luck.
All righty, Bob. Thanks so much. We're going to move on to Jeff from California. Jeff, you're on the Plastic Surgeon Show.
Hey, good afternoon. Thanks for taking my call. I appreciate it. I'm a 57-year-old male, and I have a little bit of, I'm just showing a little bit of aging under the chin. I previously had a submental liposuction there, just sort of in the office under local. And so there's a little bit of laxity. In any case, I went to the plastic surgeon recently for a lower bleph, just consultation. He goes, oh, by the way, you could use a little bit under the chin. And I didn't really, I sort of looked at it and I go, yeah, he's sort of right. And so my question was whether or not doing something now under the chin, maybe a little more, aggressive, going in and, resecting some tissue or whatever it is to tighten that up, whether that would sort of, if I wanted to do a facelift in the future and get the chin tightened up again, whether you guys feel it's more difficult, you get less correction because you've got to go back in under previously dissected areas and things like that.
So what do you think, Rich? I mean, how do you stratify somebody to do a facelift kind of, with a neck lift versus a direct excision neck lift?
So you're really an ideal kind of patient from what it sounds like. So the first thing I would do is evaluate how much laxity you have there, because there are multiple ways to address the neck. So the first one would be if you have some laxity but not terrible, and if your face is not aged, it's just really your neck that's the problem. Maybe doing a post-auricular and hairline or back into the hair neck lift. So you're doing the bottom half of the facelift, not leading to a scar on your neck. It sounds like something that you might actually benefit from because you're actually sort of not afraid of surgery. From what it sounds like, you're already thinking about doing your lower lids. You're thinking about a facelift down the road. So surgery doesn't sound like it scares you, and you could hide the scars. The direct excision is a good operation, but generally one that I do when there's laxity there that's sort of floppy, that it's worth trading the laxity versus the scar. On a 57-year-old man, generally there's not enough laxity there to accept the scar, in my opinion. So if at your age you want a better appearance and you're interested in doing other things, I would go over all the options with you, but I'm going to predict that a what we call a standard neck lift or an incision that sort of starts at the bottom of the ear, goes behind your ear, back into your hairline, would give you the best improvement to your neck. And it's sort of like half a facelift. So when you go to have a facelift in the future, you may not even need to do your neck. You may or may not. If we had to go redo it, it's not a big deal. I've done secondary and tertiary, meaning third-time facelifts on people, and it's not really a big problem to go back on a well-done facelift. There's a plane we look for, and it really doesn't cause a problem. And if you had a direct excision, we may not be able to pull back as much, but we wouldn't have to, and it wouldn't bother my ability to do a person's neck lift or facelift. So I think it's worth having that conversation if it bothers you enough. What are my options? The only thing I couldn't tell you is, and I don't have a lot of experience with it, but there are some people who are using some RF technology. I don't know, Nolan, if you guys are doing that and what your experience has been, but if you have small amounts of loose skin, there are certainly people who are using different kinds of radio frequencies and other types of energy to heat the tissues beneath the skin to try to get some retraction. What's been your experience, Nolan, if you have any?
I really don't have any experience with that. I mean, it's just not something I've done.
Yeah, I didn't know. I mean, I thought maybe, I'm sure there's someone at NYU doing it.
Oh, yeah, definitely.
Right.
Definitely, without question.
But I have not felt comfortable enough to offer to people yet to say that I can predictably get a result, so I'm not, So the answer is, I think all those things are options for you, Jeff.
That's great. So in this case, since I shaved my head completely because I'm pretty bald, you still feel that the post-auricular incision is the way to go, or not so much because I don't have hair there?
Okay, so where the scar will be is it starts at the base of the ear, goes up in the junction between your ear attached to your scalp there, and it's very hard to see. And there'll be a small scar that goes from your ear back. It depends on how much laxity you have, but those scars, even in bald individuals, I've done facelifts and brow lifts on bald men, and the scars really are not bad, and they're happy. They walk around. They don't even. Some of them don't even have to be bald. They're partially bald, and the scars actually can heal very well.
Excellent. Thank you so much. I appreciate all of the information.
Okay,
all right, Jeff, thanks so much for calling. So, Rich, let's talk about facelifts in men compared to facelifts in women. How are they different? What is different? What components do you do differently? And let's kind of talk about that. And how's the recovery different? What do men tolerate that women, how much do men tolerate compared to women?
So that's a great question.
No, it's a big question. You can sit here and talk all the rest of the time.
Let's start with how much they can tolerate.
Okay.
So, really it depends upon whether the man's had previous anything. Is he a person who's used Botox or fillers? Is he a guy who's had a rhinoplasty before? Has he had any experience with surgery? Because, obviously, it's sort of like women have had babies. They've been toughened. They come in and they've had, hysterectomies or they've had tubals. Many men come in, they've never had anything. So do you want to do every procedure that you think the patient needs on this gentleman? The answer is probably not. If a person's already had some procedures and he can tolerate the recovery and he can tolerate. So men, I would say, are a little bit, I won't say bigger babies, but, we aren't road tested and hardened by previous, giving birth, etc. So, in those situations, I tend to start off with smaller procedures to see how people tolerate it. So let's start with that question. So am I going to do a brow, four-cloud lift, and facelift on a person who's never had surgery? Only if I really think they can handle it, because otherwise it's way more than they really think they could handle. Okay, so that's the first question. So I try to segment it in men more than women. Also, it's a faster recovery when it's not all at one time. Second thing is, what do I do differently? So obviously, some of the things that we look at is like in men, we don't want to feminize their eyes. You might not take out as much fat in their upper eyelids. You don't want them as deep set. You want to be careful in your lower eyelids. You want to get rid of the loose skin, but you don't want quite the same sweep. So you're just going to be, and you're also going to make sure that the lower lids are tight either through a canthopexy or a little wedge so they don't get pulled down because they have that sort of heavy face and pull down from their cheek area. The second thing is on facelifts, I do a lot of SMAS with rolling the SMAS over.
Can you explain what the SMAS is for our listeners?
Okay, so generally there are different layers somebody can do facelifts in. You can do just the skin, where you just elevate the skin and then pull back and tighten it. And they're the people who, when you try to get a really nice result, get that windblown look because all of the tension is on their skin. And so that's not a procedure that I really do very frequently at all. And maybe just revisionally or very small areas where someone just needs a very small tuck. But I would say very infrequently. The second is, So you now have a skin layer. Beneath the skin, there is what's called the muscular fascial aponeurosis. So what you have is a layer that's above the parotid gland beneath the skin that the muscles insert into that work the face, the facial muscles. And it inserts up on the zygomatic arch and then goes down to the corner of the mouth, and there's different ligaments that attach to the different deep layers. And as we get older and we lose volume, that sort of sags. So one of the things that I find to be very valuable is to elevate that area and then bring it up and put your tension sutures actually on that layer to reposition your fat where it belongs and the muscles back where they belong. And when you do that, there's usually laxity in the up and down direction. So I usually fold that over and build up their cheekbones to give women a more exotic look, a higher cheekbone appearance. But I don't do that in men, right? So in men, I will tend to excise that segment and sew it beneath the zygomatic arch. I'm not trying to feminize the person and give them a feminine, exotic appearance. I'm trying to tighten and reposition things back where they came from. So, number one, that's the first thing. The second thing is, same thing, the muscle tightening in the neck is probably very similar in men and women, so that's the same. And then it's placement of scars and considering, where is their hairline, whether they're bald, whether they, where exactly their sideburn is. Am I going to do incision along the hairline, or am I going to go up above the ear? And how high, will their sideburns come up? Because, again, men wear their hair shorter than most women. Of course, you have to be concerned about that, but the average male that I see wears shorter hair. And so I'm very concerned that I don't have a big bald spot above their ear in their temple area. So, and also, so I probably make more hairline incisions from the top of the ear forward in men than I do women. And also, I'm more of a pre-tragal incision person than most people than post-tragal, because I think post-tragals are great 90% of the time, but 10% of the time you pull out their tragus and you can see into their ear, and you lose that indent in front of the tragus. And so I'd rather, with a pre-tragal, you have an incision right in front of the ear that falls in one of the fold lines, heals well, and you get a triple every time. Rarely do you not get a triple. So going for a home run and getting what I think is a suboptimal appearance 10% of the time, so I'm a pre-tragal person.
No, I'm the same way. I feel that you're pulling face skin over the ear, which is very thin skin, and it's very hard to get that to look right.
Exactly. You lose that indent, and many times, if it's pulled even a little bit too tight, it opens up that canal, and you can say, oh, that person's had
it's a giveaway. You normally don't notice people's tragus, but if it looks funny, you notice it right away.
Exactly. And so that's one of the things about men is you just can't afford that at all. Men can't afford, they're better off with a triple than an attempt at a home run and then looking bad. So that's the important part about the pre-tragal area. No tension, just lay the skin down after you have the SMAS where you want it so that it doesn't look over-pulled. And then post-tragally, make sure the incision's in that, as everyone does, between the ear and the scalp, knowing, and then it's important you bring it up high and then come back either into the hair, if they have hair, or sometimes if you bring it up high, you don't need to go posteriorly. If someone's bald, you can try to get away with it. And of course, it has to do with how much laxity do they have in their neck. And if they have a lot of laxity, then and you need to correct that, then you're going to make an incision. The incision behind there is not seen by him ever. It is seen by other people sometimes. And the goal is to not have it be seen. So you're going to try to hide along the hairline and back into the hair itself, and avoid, when you line things up, avoiding a step off along the hairline. And I think they're the keys. And again, in the hair, I will use little staples because you get less hair loss, but I have buried deep layers of sutures, and then I pull out proline so they don't have stitch marks. and it's important you take out your sutures in the pre-auricular area in 5 days so you don't have stitch marks there. So it's all part of the management. And then, of course, post-operatively, teaching people how to massage their scars and use topical silicone, because you really want the scars to be as perfect as possible. So I think that's all part of, getting them happy with their result long term.
All right, thanks, Rich. We're going to move on to Don from California. Don, you're on the Plastic Surgery Show.
Yes, I have a question pertaining to free radicals in your body. Free radicals, as I understand it, can damage your tissue. And if you have, mine is very low. It's 0.2 to 3, sometimes 4. And I'm 90 years old as of October this year, and I don't have, wrinkles don't seem to be an issue. People say, when they know my age, they say, well, you don't have wrinkles. Well, what I do have is sagging of the skin. I had a benign carotid examination. They removed it behind my ear, and I noticed that when they finished, they pulled the tissue up when they did the sewing, and I noticed that one side of the face wasn't sagging as much as the other. And I'm wondering, what is done to take care of the muscle relaxation or the inability of the muscles to stay in control so that it doesn't sag down? And that plus the free radicals, those are my questions.
Have you ever heard anything about free radicals and facial aging or aging, Rich?
So the answer is that's not something I'm familiar with. That's more of a homeopathic kind of discussion. But, obviously this gentleman, you said he was 90, is that what he told us?
90.
Yeah, so God bless you. Hope we all get there. Whatever you're doing, keep it up. As far as, your question about muscles, this is what we were talking about. As we get older, our skin, we lose volume, and our skin and muscles sort of sag and drift down. Now, when you had your parotid operated on, they elevated that SMAS layer we were talking about. They took out part of your parotid, I guess, and then they closed things. So some scar tissue formed in there, as well as them sewing it back down, which is probably that's the side that looks better on you, because you've had sort of a little, even if they didn't take skin off, or they might have taken some off, that side looks better. And so, in essence, that's sort of what they do on the other side, but more purposeful and without affecting your parotid or worrying about parotid fistulas, is to elevate your SMAS and then reposition your skin and make that side look better. So, yep, that's what basically we're doing when we talk about facelifts. And he's a classic example. Men have thicker skin; they don't get as many wrinkles, but they do get sag.
All righty. We are going to move on to Priscilla from California. Priscilla, you're on the Plastic Surgery Show.
Hi, this is Priscilla.
Okay, how are you, Priscilla?
Hi, I'm fine. Calling for my husband. He has extra skin under his chin. It's kind of like a waddle, and he doesn't like it, and he wants to know what can be done.
How old is he, Priscilla?
70.
70.
I'm sorry, 71. Yeah, 71.
And is he in good health?
He's in very good health.
All right, Rich.
He has a bout of sciatica, but that's unrelated.
All right, so Priscilla, let me ask you a couple questions. How's the rest of his cheeks and his jowls and all those sort of things? How does that all look?
I think it looks great. It looks firm.
So everything is the waddle in his neck, is that right?
Yes.
So he's a perfect candidate for a direct excision, which could be done under local anesthesia or some PO sedation, because the rest of his face he's happy with. He's 71 years old. It's really minimal downtime, and we would just basically demonstrate to him what the scar would look like and whether he'd be willing to accept having a scar that will fade away with time but be present versus having that loose skin there. And so he's a classic example, Nolan, of someone who I think a direct excision would be a good operation for.
And what is involved in direct excision? Just cutting it out?
So in essence, what you do is you diagram sort of a straight line straight down and then a little transverse scar. You numb the entire area. You evaluate whether there's muscle weakness or whether there's extra fat there. You make an incision. You then go in and you if you need to, either take out some fat and put the muscles together, and many times you don't, and many times it's just moving the skin over and trimming it so that it's just the right amount of skin removed, giving you the best scar and the most skin excised, and then you take off some both vertically and horizontally so it lays in there nicely, and that's basically it.
Okay, and what is the downtime on that?
So, he'll be able to get up and walk around the next day. He'll be able to eat regular food. It's not really painful. He does have some sutures there that we generally take out in 5 days, and then he'll have to start massaging. We usually don't have people increase their blood pressure or do any kind of aerobic activities for 2 weeks. He can walk all he wants to, and at 2 weeks he can do jogging and light activity. In a month he can do anything he wants.
Wow, that's a short recovery time.
Yep, it's not really that big a deal. We just want to prevent you from getting bleeding.
All righty. Listen, Priscilla, thanks so much. We have one quick last caller. Rich, John from Ohio. We only have about a minute and 20 seconds left.
Go ahead.
John, you're on the Plastic Surgery Show.
Can you hear me?
Yeah. Quickly.
I had a mini lift about 6 months ago by a plastic surgeon that only does facial work. And prior to that, I was one of those people that, like, the left side of my face, I'd always take pictures from that side and had a certain level of attractiveness that was really high, but my other side of my face was kind of different. And so I guess when he did the correction, he tried to even that up, and now I have real pretty good symmetry, but in some ways I don't like the look as much. I was just wondering, like, do some plastic surgeons look at symmetry as much as just saying wanting to look not necessarily younger is the most important thing, but also, increase your attractiveness?
Rich, we literally have 10 seconds.
So what I would say to you is each plastic surgeon needs to find out what the patient wants and discuss that before they start so that we can try to have a plan that will solve what you want. And so, it's not like we just decide what to do. Hopefully we have a discussion with you. And so, that's something you can talk to your plastic surgeon about.
All right, Rich, thank you so much. We really appreciate it. This was a great segment, and we need to take a break. Remember, the Plastic Surgery Show is live every Tuesday from 6 to